Today we'll be discussing the toxicology of Aripriprazole, a second-generation antipsychotic widely used in psychiatry. It's known for its unique pharmacological profile and is often prescribed for conditions such as schizophrenia, bipolar disorder, and major depressive disorder. We'll focus on the mechanism of action, symptoms of overdose, and appropriate treatment strategies. Mechanism of action. Aripriprazole is classified as an atypical antipsychotic, but its pharmacological profile distinguishes it from other drugs in its class. Here's a breakdown of its mechanism. Partial agonist at dopamine D2 and D3 receptors. Aripriprazole is a partial agonist at the D2 and D3 receptors. It can act as both an agonist and antagonist depending on the endogenous dopamine levels. In dopamine-rich areas, like in schizophrenia, it serves as an antagonist. In dopamine-deficient areas, it provides partial agonism, reducing the risk of extrapyramidal symptoms. It is a partial agonist at serotonin 5-HT1A receptors. This action is thought to contribute to its antidepressant effects. It can also help mitigate some side effects like akathisia, a common issue with many antipsychotics. Antagonist at serotonin 5-HT2A receptors. This antagonism is similar to other atypical antipsychotics, contributing to aripriprazole's antipsychotic effects. It is also associated with lower risk of hyperprolactemia compared to typical antipsychotics. Other receptor interactions. Aripriprazole has moderate affinity with other serotonin receptors, including 5-HT2C and 5-HT7, as well as alpha-1 adrenergic and histamine H1 receptors. These interactions contribute to its sedative and hypotensive effects, though they are less pronounced compared to other antipsychotics. Aripriprazole's unique mechanism allows it to be less sedating and causes fewer metabolic side effects than other antipsychotics. However, this profile does not render it free of toxic effects, especially in cases of overdose. Now, the symptoms of aripiprazole toxicity. Aripiprazole is generally well tolerated at therapeutic doses, but overdoses can lead to a range of symptoms that vary in severity based on the dose ingested, patient factors, and co-ingestants. Common symptoms of aripiprazole toxicity include sedation. Due to its partial agonism at D2 receptors and other receptor interactions, excessive sedation is the most common symptom in overdoses. Dizziness and confusion. This is often due to its antagonism at alpha-1 adrenergic receptors. Agitation and restlessness. Despite its sedative potential, paradoxical agitation can occur, possibly due to the partial dopamine agonism. And extrapyramidal symptoms. These can include tremors, rigidity, dystonic reactions, though less common compared to older antipsychotics. Regarding the cardiovascular effects, tachycardia. This is common in aripiprazole overdose and is typically benign. Orthostatic hypotension caused by alpha-1 adrenergic antagonism, leading to dizziness upon standing. QT prolongation. Aripiprazole generally has a low risk of QT prolongation, but in high doses, it can pose a risk, especially in patients with existing cardiac conditions. Regarding the gastrointestinal effects, nausea and vomiting. Due to serotonergic effects, GI symptoms can be prominent in overdose scenarios. Rare but serious symptoms include neuroleptic malignant syndrome. This is a rare but life-threatening condition that can present with hypothermia, altered mental status, muscle rigidity, and autonomic instability. Seizures, rare, but a possibility in severe overdose, especially if the patient has a predisposition or other co-ingestions that lower the seizure threshold. Now, the management of aripiprazole toxicity is largely supportive, as no specific antidote exists. Here's an outline of the approach. Regarding the initial assessment, obtain a thorough history, including the amount ingested, co-ingestants, and the timing of the overdose. Focus on assessing airway, breathing, circulation, the ABCs, and mental status. Monitor for signs of severe CNS depression or agitation. Next, decontamination. Activated charcoal can be considered within 1 to 2 hours of ingestion if the patient is awake and alert. It can reduce absorption if given early. Gastric lavage generally is not recommended due to the risk of aspiration, especially in sedated patients. And supportive care. Cardiovascular support. For tachycardia or mild hypotension, monitoring and supportive care are usually sufficient. Intravenous fluids can be given for hypotension. CNS symptoms. If the patient is agitated, benzodiazepines such as lorazepam can be used to calm agitation. For severe extrapyramidal symptoms, diphenhydramine or benztropine can be administered. Seizure management. Benzodiazepines are the first line if seizures occur. Regarding monitoring and observation, patients with mild symptoms should be monitored for at least 8 to 12 hours due to aripriprazole's long half-life, which can range from 75 to 94 hours. In cases of severe overdose, longer observation may be needed to monitor for delayed complications, such as neuroleptic malignant syndrome or prolonged QT intervals. Consider admission for patients with significant sedation and abnormal EKG findings, such as QT prolongation, persistent agitation, or those requiring IV fluids for hypotension. And in severe cases, consultation with Toxicology or Poison Control Center can be invaluable for guidance on advanced management strategies. Personally, I'd recommend reaching out to Poison Control immediately. In summary, aripiprazole, while effective in treating a range of psychiatric conditions, can pose a risk of toxicity, particularly in overdose scenarios. Understanding its unique mechanism, recognizing symptoms of toxicity, and implementing supportive care are crucial for safe management. As always, keep your head up. You're doing great. You're better than what you were yesterday. That's a lot. Learn something new today. Gonna be a great doc. Sometimes you just gotta hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.